91 question. In primary immune response, how much more antigenic dose is required to induce IgG antibodies as against the induction of IgM antibodies? So, for IgG antibodies, it is 50 times more than for the IgM antibodies. So, answer here will be C. Pentavalent vaccine include what all? So it include DPT plus hepatitis B and HIV. So answer here will be D. Consider the following data for the country. What shall be the dependency ratio? So for dependency ratio, in the numerator it should be 0 to 14 age and above 65, and in denominator it should be between 15 to 64. So after calculating, answer will be 54.1. Which of the following statement regarding the rabies immunoglobulin is not true? It should be administered only once as possible. Yes, this is true. It should be administered all into or around the wound site. This is also true. There is no scientific grounds for performing the skin test prior to administering the equine immunoglobulin. This is also true. So here skin test is not generally done. It can be administered till 15 days. No, this is not true. It can be given only till 7 days. So answer here will be D. All the following are true about the bedaquiline except. So for bedaquiline, we know that it is a ATP. It is specifically target the mycobacterial ATP synthase. This is true. It is a bacteriostatic. No, this is not true. It is a bactericidal drug. So answer here will be B. It has the extended half-life. This is true. It has high volume of tissue distribution. This is also true. So answer here will be B. Visual inspection based screening test with 5% acetic acid is used for. So this is direct question. Cervix cancer. B is the correct answer. Predictive accuracy of the screening test depends on which of the following? Disease prevalence. This is true. Sensitivity and specificity. This is also true. But it do not depends on the incidence. So answer here will be B. How much zinc supplement is recommended by WHO and UNICEF for less than 6 months? So for less than 6 months it is 10 mg, and for greater than 6 months it is 20 mg. So answer here will be B. Which of the following statement regarding the sequential administration of the IPV and OPV vaccine is not true? It will be cost effective in the developing country for polio prevention. This is true. The combined schedule of IPV and OPV appears to reduce or prevent the vaccine associated paralytic polio. This is also true. Intestinal mucosal immunity is lost. No, it is not lost after the IPV administration. So answer here will be C. What is the recommended dose of regimen of the vitamin A for treating early xerophthalmia? So it is a 2 lakh international units on 2 successive days. So answer will be B. Which of the following is the most specific causative agent of rabies? So this is a direct question. It is a Lissa virus serotype 1. So serotype 1 is most commonly involved in the rabies. Which of the following is the antibiotic of choice for the prevention of rheumatic heart disease? So for rheumatic heart disease, we know that for prevention we generally gives benzathine benzyl penicillin. So for adults it is 1.2 million units, and for child it is 60,000 units, and it should be given thrice a week. All the following are the global targets for WHO Global Action Plan for prevention and control of NCDs except okay, a 10% relative reduction in risk of premature mortality from cardiovascular diseases, cancer, diabetes and chronic. No, this is not true. 10% relative reduction in prevalence of insufficient. Yes, this is true. 10% relative reduction in mean population intake of salt and sodium. This is also true. At least 10% relative reduction in the harmful use of alcohol. This is also true. So answer here will be A. Under the ESI scheme, extended sickness benefits is provided for which disease? So they are generally provided for the chronic diseases. So tuberculosis, leprosy and chronic empyema all are correct. So answer here will be D. In the context of NCD prevention and control in India, the extent of relative reduction in the household use of the solid fuels as a primary source of energy for cooking by 2025 is targeted at. So it is 50%. So 50% reduction in the use of the solid fuel should be there by the 2025. Consider the following criteria which may indicate elimination of the lymphatic filariasis in the community. When lymphatic filariasis ceases to the public health problem, this is true. When the number of mycofilaria carriers decline to 1.5%, no, this is not true. It should be less than 1%. When children born in the community after the initiation of the elimination program are free from circulating antigemia, this is true. So answer here will be 1 and 3 options are correct. So option C will be the correct answer. Holdover time of the cold chain depends on all the following except. So holdover time is the time when there is power cut off. So it depends on the ambient temperature, this is true. Quantity of the vaccines, this is true. Types of vaccine kept, no, this is not true. Condition of the ice pack lining, this is true. So answer here will be C. Which of the following is correct regarding the PQLI? It consolidates infant mortality, life expectancy at 1 and literacy, this is true. It does not measure the economic growth but measure the result of economic policy, yes, this is true. For direct economic growth HDI is there, but it indirectly, PQLI indirectly tells about the results of the economic policies, and the range of PQLI is between 0 to 100, this is true. So answer here will be option D. 1, 2, 3 all are correct. Disability adjusted life year daily includes, so it includes YLL plus YLD. So answer here will be both C. Which of the following are the healthcare delivery indicators? So population per trained birth attendant, this is true. Population per health or sub-center, this is true. Nurse, doctors and nurse ratio, this is also true. And others are doctor population ratio and population bed ratio. So answer here will be D. All are correct. Which of the following is the key action areas are incorporated in the Ottawa Charter? So in Ottawa Charter, building health policy, public policy are there, this is true. Strengthening of the community action for health, this is true. Reorienting the health services, this is also true. So answer here will be D. 1, 2, 3. Under chapter 21 of the 10th revision in the ICD 10, lifestyle related problems falls under which of the following code range? So it is a direct question, we have to learn it. It falls under the Z72 to Z72.5. Which of the following are spread by the airborne infection? So influenza, chickenpox, Q fever and psittacosis, they all spread by the airborne transmission. So answer here will be D. Dash diet is advocated in the control of which of the following disease? So dash diet is for the hypertension. The full form of dash is dietary approach to stop the hypertension. Endemic ascites is related to the, so endemic ascites occur by the pyrazolidine toxin, and it is a naturally occurring toxin, and there is the mixing of crotalaria junjunia in the millets. So answer here will be naturally occurring toxin, option A. The presence of which of the following bacteria in drinking water is an important confirmatory evidence. So for if we are talking about the confirmatory evidence, then it will be streptococci, but generally we do E. coli for the plate count. But it is asked for the confirmatory evidence of the recent fecal pollution, then it is streptococcus. With the regards of the goals, milestone, targets for the global technical strategy for malaria, consider the following. Compared to 2015, the target is to reduce the malaria mortality rate globally by at least 90% by year 2030. This is true. Compared to the 2015, the target is to reduce malaria case incidence by 90% by the year. This is also true. Eliminate malaria from at least 35 countries when malaria was transmitted in 2015. This is true. So answer here will be D. All are true. Which of the following IUDs is associated with the low pregnancy rate? 0.2 per 100, less number of ectopic pregnancy and lower menstrual blood loss. So IUD which is related which has the low pregnancy rate 0.2 per 100 is LNG20 Mirena. The incidence of diarrhea is highest among the infants in the age group 6 to 11 due to all the following reasons except. So declining level of maternal antibodies, this is true. Introduction of food which may be contaminated, yes, this is true. Eruption of the teeth is not related to the diarrhea, so this is not a correct option. Answer will be this one. Direct contact with the human and animal feces, this can be true. So answer here will be C. In the context of anti-malarial month campaign, consider the following statement. It is observed every year in the month of June. Yes, this is true. It is planned during the monsoon season. No, this is not true. It is planned before the monsoon season. It aims to enhance the level of community awareness and participation. This is also true. So answer here will be 1 and 3. Thank you.